Hepatitis B viral DNA test. Introduction. Hepatitis B virus, HB, is a DNA virus that primarily infects the liver, leading to both acute and chronic hepatitis. Chronic hepatitis B infection is a global health issue that can progress to cirrhosis, liver failure, and hepatocellular carcinoma, HCC, if not properly managed. The HBV DNA test is a molecular diagnostic test that detects and quantifies the viral DNA in a patient's blood. It is widely used in both diagnosis and monitoring of HBV infection and is more sensitive than serological markers such as HBsAg or HBe. Number 2. Definition. The hepatitis B viral DNA test, also called HBV DNA quantification or HBV viral load test, is a nucleic acid amplification test, usually performed by real-time polymerase chain reaction, PCR, that measures the exact amount of HBV DNA present in the blood. Results are expressed as international units per milliliter, IU milliliter, or sometimes as copies milliliter. It indicates the degree of viral replication and infectivity of the patient. 3. Indications. Doctors may order this test in the following situations: diagnosing active hepatitis B infection, especially when other serological markers are inconclusive; monitoring patients with chronic HBV infection; evaluating treatment response to antiviral medications, e.g. tenofovir and entecavir; detecting HBV reactivation in patients undergoing immunosuppressive therapy, chemotherapy, organ transplant, biologics; assessing risk of vertical transmission, mother to child, in pregnant women, predicting disease progression to cirrhosis or HCC. Number 4. Used for this test is primarily used for diagnosis, identifies presence of replicating HBV; monitoring, tracks viral load trends over time; treatment guidance, helps determine if and when to start or adjust antiviral therapy; prognosis, higher viral load correlates with higher risk of liver damage. Now 5. Why do need of this test? The test is important because it provides direct evidence of viral activity. Serological markers, HB-Sag, may not always reflect viral replication, but HBV DNA gives a true quantitative measure. Detects occult HBV infection where HB-Sag is negative but viral DNA is detectable. Assists in preventing complications by identifying patients at high risk. Ensures that treatment is working effectively. Falling viral load equals good response. Number 6. What happens during test? Step 1. Blood sample collection. A healthcare provider inserts a needle into a vein, usually in the arm, and collects a blood sample. Step 2. Laboratory processing. Plasma serum is separated. DNA is extracted from the sample. Real-time PCR, RT-PCR, is used to amplify viral DNA. Step 3. Quantification. Specialized equipment measures the number of viral DNA copies and reports it as IU milliliters. The procedure is quick, a few minutes, and not painful beyond the needle prick. Number 7. How long for my results? Results are usually available within 1 to 3 working days, depending on the laboratory setup. In urgent hospital settings, same-day results may be available. 8. Prepare for this test. No fasting or special diet is required. Continue usual medications unless otherwise advised. Inform your doctor if you are on antiviral therapy or immunosuppressive drugs. Ensure proper rest and hydration before blood draw to minimize discomfort. 9. Risks. The risks are minimal and related to blood sampling. Mild pain or discomfort at puncture site. Bruising or swelling. Rarely, dizziness or fainting. Very rare chance of infection at needle site. Number 10. Normal values, undetectable HBV DNA, 10 to 20 IU milliliter, varies by lab sensitivity. Detectable values indicate active replication. Reference ranges commonly used: 2,000 IU milliliter, low replication, minimal disease activity; 2,000 to 20,000 IU milliliter, moderate replication, may require closer monitoring; 20,000 IU milliliter, high replication, increased risk of liver damage, treatment often indicated. In HbAg positive patients, high replication is usually defined as 200,000 IU milliliters. Number 11. Interpretation results. Undetectable HBV DNA, no active replication, treatment effective, or patient is an inactive carrier. Low viral load, 2,000 IU per milliliter, low risk of liver damage. Treatment may not be required, but monitoring is needed. High viral load, 20,000 IU per milliliters or 200,000 IU milliliter in HbAg positive, indicates active replication, increased infectivity, and higher chance of disease progression. Rising viral load indicates treatment failure or reactivation. Falling viral load suggests effective therapy. Number 12, factors affecting results. Medications, antivirals suppress replication. Lab method sensitivity, different PCR assays have different cutoff values. Sample quality, hemolysis, contamination, improper handling. Co-infections, HIV, HCV, HDV, may alter viral dynamics. Immunosuppression may lead to clinical significance. Guides treatment initiation. Persistent high HBV DNA levels often require antiviral therapy. Monitors disease progression, helps in predicting risk of cirrhosis and liver cancer. Prevents vertical transmission. Pregnant women with high viral load are treated to reduce risk to the baby. Evaluates treatment success. Goal of therapy is undetectable HBV DNA. Differentiates inactive carriers from patients with active disease. 14. Know more. HBV DNA test is more reliable than HBsAg or HBeAg in assessing viral replication. Results must always be interpreted along with liver function tests, ALT-AST, liver ultrasound, and biopsy fibroscan findings. Regular monitoring, every 3 to 6 months, is essential for patients with chronic HBV. In clinical practice, HBV DNA test is often ordered together with HBeAg, HBsAg, anti-HBC IgM IgG, and liver function tests for comprehensive evaluation. 15. The hepatitis B viral DNA test is a cornerstone investigation in the management of hepatitis B infection. By providing a quantitative measure of viral replication, it helps clinicians decide on treatment, monitor progress, and predict long-term outcomes. It is especially useful in chronic HBV infection, antiviral therapy monitoring, and preventing complications such as cirrhosis and liver cancer. Regular follow-up with this test ensures better disease control and improves patient prognosis. Thank you. Have a nice day. Thank you. Have a nice day.